Well, today the President and the Deputy President visited the Aspen manufacturing site. This is of the Johnson & Johnson vaccine. But until recently, the government has come under fire, and this is over the AstraZeneca shots that it first brought in from India's Serum Institute. First, it was hammered for ordering them too late, then criticized for the close expiry date, followed by a lashing over selling them to unspecified African countries. So what's the science? Joan Van Dyk of the Bhekisisa Centre for Health Journalism joins me now. Joan, it's been a lot of back and forth when it comes to these AstraZeneca vaccines, and I think if we're truly being fair to government, it hasn't been a clear nor an easy road to walk, because we've seen, watching from the outside, how many times they too are almost flowing with the developments as they become available to the public, especially in terms of what the science is saying. But of course, many people right now are questioning whether it was the right thing to sell the AstraZeneca vaccines to the African Union.
Yeah, there's a debate among South Africa scientists at the moment, and essentially what it's the core of it is, how do we make decisions that affect the whole country when there's very scant evidence to go around? Because that's the main issue. The evidence for the AstraZeneca vaccine is all negative when it's measured up against the 501YV2 variant that's now dominant in South Africa. And on the one hand, you've got a small group that are arguing that this is a huge missed opportunity to vaccinate 1 million people with a safe vaccine before we get to the third wave. And the World Health Organization is in this corner. They've put out advice that this vaccine should be used, even in countries where there are these variants circulating. The other camp is the vaccines MAC and the health department saying, yes, it was the right move to sell, because the issue here is not the safety of the vaccine, it's the variant and its effects on the vaccine. And we have now data that shows that it's only 10% effective for moderate disease, and lab studies that show that AstraZeneca jab actually doesn't neutralize the variant, while we know that others do, like the Gamaleya vaccine from Russia and the J&J vaccine, they actually do neutralize the variant. Then we have, as you mentioned, in February when we bought this, we had the April expiry date to think of. And then the last thing that's been taken into account is the issue of public trust. The MAC felt that if they authorized the vaccine to use in this rollout, and people were still getting sick after using it, that they wouldn't believe that it'll work when the next vaccine comes around.
Joan, there's of course the other conversation, and it's not happening as vociferously perhaps as it should be, and this is the interest that scientists themselves have when it comes to some of these vaccines.
Yes, there's always that issue to be discussed as well. There are some questions around the data that came out, the AstraZeneca trials in South Africa especially.
When we look at South Africa, why didn't we test the AstraZeneca vaccine with an implementation study like we're doing with the Johnson & Johnson under the Sisonke protocol?
Yeah, the argument there is that it wouldn't have been worth it. It would have taken months for us to get worthwhile data through an implementation study like Sisonke. And as we know, the AstraZeneca jab, you need 2 doses to be considered fully vaccinated. And the new guidance from AstraZeneca and the World Health Organization is that those jabs should be taken 3 months apart. So by the time we had any meaningful results, it could have been about 8 months later, in August of this year. And by that time, there may very well have already been a second generation vaccine with the variant in mind, not to mention that there might be a new variant that pops up. And so it would have been a wasted effort that would waste resources, and the results would be too late to be usable, really.
All right, Joan Van Dyk, let's leave it there for this evening.